it can occur in anyone. It can do whatever it can. Like it can occur in children, it can occur in old people, it can occur in rich, poor, even in animals. So there is no barrier for cancer. It can affect anyone. So these are some of the famous personalities with some who are surviving or who have survived cancers. Any idea? Anyone can identify them?
Rishi Kapoor, Gautami, Steve Jobs.
Yeah, Rishi Kapoor, what cancer? Any idea?
Is it lungs?
Okay, initially it was lung, then finally it came out as he is suffering from some sort of blood cancer. The lung is now Sanjay Dutt. He is having lung cancer. He's still on treatment and doing good. Gautami,
Breast cancer.
Breast cancer.
yes, yes. Steve Jobs,
Head cancer.
he had some pancreas cancer.
Uh, Pancreatic cancer. Sonali Bendre.
Okay. So these are some of the famous personalities. Okay, Sonali Bindre, again a uterus cancer. Lisa Ray, sort of blood cancer. So so lot of celebrities. So cancer can affect anyone. Now, what are the early signs? Early signs which helps you to detect cancer. Now, these complaints, whatever I put through, can occur in normal conditions also. Like bleeding can occur with patients with piles also. But what is the underline is, suppose someone is having unusual bleeding, say for more than a month or 2 months, then it requires your attention. You have to immediately meet your doctor to look for what it is, like your change in your bowel habits. If there is unusual constipation or diarrhea, if there is a sore which doesn't heal for more than a month, if you feel that there is an unintentional loss of weight, or there is sudden appearance of mole or what like that, all these things in breast, if you take, if there is suddenly a lump which you see recently, so these things when it is present for more than 4 weeks, a month, you should immediately present to your family physician. Now, what is the reason for cancer? Cancer, you generally we tell it as acquired and familial. Familial means where in families it runs. The cancer can run in some families, like the grandmother may have, the granddaughter may have, multiple family members will be affected, but that forms only less than 5% of all cancers. Less than 5% of all cancers only is genetic or runs in families. Because many times we have patients who ask, sir, my grandmother had cancer, will I get cancer? Or my mother has, will I get mother? So these things running in families is less than 5%, so you don't have to worry. So rest, what is the other reasons we call as acquired, which are modifiable, which I will elaborate it now. And there are more than 50% of the times we don't know why someone is getting cancer. So, as I mentioned, less than 5 to 10% of all cancers is familial cancer, especially breast, ovary, colon. These are the cancers which can run in families, but it is only less than 5% of the time. So, what are the other causes which can be preventable? So, as per data, 42% of all cancers are preventable, and this is the list of reasons which are preventable: smoking, obesity, alcohol, UV radiation, physical inactivity, and poor diet. Of these, smoking tops the list. More than 20% of all cancers can be stopped if someone looks into their smoking habits. So smoking, as you know, it is not just cancer. So on the right side, you can see in red, it is all the conditions which are caused by smoking and that cancer, associated cancer. And on the left side, all these are the non-cancerous conditions. So smoking can cause multiple cancerous and non-cancerous conditions. So avoiding, quitting smoking is the best thing to do, especially for lung cancer. Smoking has a very big casual factor, because a cigarette has 72 carcinogens. Carcinogen means an agent which is the reason to cause cancer. That is called as carcinogen. So, like that, there are more than 4,000 toxic substances in one cigarette, of which 72 are proven, scientifically proven carcinogen. Not just smoking tobacco, even smokeless tobacco, chewing tobacco also causes cancer, especially oral cancer. The habit of chewing tobacco is not that prevalent in southern states, but if you go to northern states, chewing tobacco is a very common habit, and we see a lot of patients with oral cancers. So some of the effects to how to quit smoking. Someone really wants to quit, but they may not be able to quit. So some tips are: you should stop having friends who smoke. Avoid sitting with smokers or tobacco chewers. There are special tobacco cessation clinics. There are special helplines which give psychiatric counseling to them. And a short-term replacement is the cigarette. It has nicotine, that is the addictive substance. So there are nicotine chewing gums available, which serves as an alternative. But again, these are temporary stopgap arrangements. In long term, quitting smoking and these things is the best thing to go. Next thing is alcohol. So alcohol consumption also causes cancer, and the most common associated factor is breast cancer. They found that 30% of reason is alcohol in women. Not that prevalent in our country, but if you take Western world, alcohol and smoking is very common. So they associate 30% of the times that alcohol is a reason for breast cancer. And apart from that, there are multiple other cancers which are displayed. I hope you are able to see. Is the
Yes,
slide
doctor.
visible? Yeah. Yeah. Thank you.
Yes, doctor.
Yeah.
The
So there is.
questions can be asked now or at the end of the
It is better you can note it down and keep, and at the end we will take it in one go.
okay, thanks.
So these are the So many times, I have questions from my patients. What is the recommendation? Should we totally avoid? See, smoking is very dangerous. We advise it to be quit, but alcohol for social reasons and other reasons, people, they have a minimal limits. Not everyone drinks or smokes a lot. So these are the recommended guidelines. How much someone can have alcohol? So in general, they say two standard drinks for men and one standard drink for women. So another thing to notice, this is a daily limit. It should not be like, okay, over the weekend you combine all these 2 into 7, 14 drinks and you can have in a go. So you cannot binge drink also. So there should be a limit. This is for daily, but it doesn't translate into a weekend limit having binge. So these are the minimum recommended levels for accepted levels for alcohol. Obesity is now becoming a very major problem. Say 20, 30 years back, obesity was not much a problem, but now in India, since we are also moving slowly to, I would say rather fast, very fastly, we are moving towards westernized diet, culture, civilization. Obesity also comes with that. And obesity is again one common reason which can help in causing cancer, especially breast cancer, uterus cancer. There are a lot of ladies with uterus cancer who come very obese, hypertensive, diabetic. These are reasons for uterus cancer. So obesity is a very important thing to note, and which is very common in more than 50 years age group in India. Especially, I see this attitude in my clinic when you ask about weight. The general reply among ladies will be, sir, 40 வயசாயிடுச்சு இதுக்கு மேல என்ன சார் எல்லாம் பேரம் பேத்தி வயசாயிடுச்சு நம்ம வெயிட் பார்த்து என்ன சார் ஆக போகுது. So they generally tend to ignore themselves. They feel everything is all right, everything is fine, which is a very bad attitude. And as you all know, risk to reduce cancer, healthy diet. It's not just for cancer. It is in general for any disease-free condition. Diet, what you eat is very important. Exercises, physical activity. At least you have to walk half an hour a day. Maintain healthy weight and alcohol as advised in moderation. Please avoid as much as processed food. All these tinned, canned, packed foods. Everything is rich in preservatives which can cause cancer, or rich in salt and sugars which is again harmful for your heart and everything. So try to avoid as much as possible. Red meat, again, not so common in India, but it is very common in Western countries. That's why the incidence of colorectal cancers is very high. Red meat you should take all you should try to avoid. All good whole grains, vegetables, fruits, these are very good. Try to have more of these things. So, is there any vaccine? Now, all of you know about COVID vaccine. Like that, you may wonder, is there any vaccine which can prevent cancer? There are so many cancers, but we don't have vaccine yet for all of them. We have one particular vaccine which is called HPV vaccine. This is against cervix cancer. And as I told you, cervix cancer is the second most common cancer in India. This vaccine helps and gives 99% protection. And there are different dosages for that. The recommended age group will be girls, young girls. Young girls will say 12 to 14 years, you start vaccination for them at that point of time. So if you have any girls of that age group, you can always advise this HPV vaccine, which helps to prevent cervix cancer. So now, early detection of common cancers. I'm going to discuss only about two cancer, breast and cervix. So now imagine this oranges as the breast of any lady, and what do you expect? What do you think that is abnormal? So this is what I'm going to tell you. How do you present yourself to your doctor in case of any such similar findings? So feeling of thick area in any breast, in any area of your breast, if there is a thickening which you feel, if you see a dimple, dimple means kuri mari irukkiradhu breastla, if you see any dimple, pallam, then nipple crusting, if the nipple has some wound or an ulcer because of that, and then sometimes it may be red or hot in your breast areas, discharge from your nipple. It could be blood discharge or any discharge. Usually blood discharge, you should be very careful. Apart from that, sometimes you can get greenish, blackish, which is some sort of infection. But any discharge, you see your physician immediately. Skin sores, any ulcers on the skin, any bumps or lumps means katti, any hard bumps or lumps in your breast which you recently noticed. This is the most common complaint. The only common complaint among 90% of breast cancer patients is, சார் குளிக்கும்போது கை வச்சு பார்த்தப்போ லேசா ஒரு கட்டி தெரிஞ்சது சார், 3 மாசமா இருக்கு, 4 மாசமா இருக்கு, வலி இல்ல, அதனால நான் அப்படியே விட்டுட்டேன் சார். So I noticed the lump 2-3 months. It is there. It is not growing in size. It is painless. Hence I ignored it. This is the most common complaint for 90% of the ladies. Okay. So you must understand, in cancer, the lump which is felt will be painless. Okay. Most of the time it will be painless. You should not think that only a painful lump will present with cancer. So any painless lump, be very careful, you report immediately. Next, if you see some growing veins around the breast, sunken nipple, if the nipple has recently drawn inwards, or if there is a change in shape or size of the breast, if your breast skin looks like an orange skin. So all these are the most common signs of breast cancer, and the most common among them will be a painless lump. So we have, how do we do breast screening? So there is something called as breast self-examination, which usually be advised from 20 years of age, where they feel the breast for themselves in front of mirror or while bathing, and they look for any lumps and they come to present to the doctor. The other thing is mammogram. Mammogram is a sort of X-ray, special X-ray for the breast, which is usually done after 40 or 45 years of age, once in a year. So in Western countries and UK, if you see, this is part of government screening programs where the lady will be called back every year or once in 2 years to do mammogram. And they have a proper channelized, arrangements for breast screening. Routinely it happens. But in India, we don't have such. So it becomes your personal responsibility to go to the hospital and take a screening after the age of say 40 or 45 years, yearly once or once in 2 years, mammograph the breast. Now this is a simple chart of breast self-examination where you are plotting or, yeah, am I audible?
Yes, doctor.
Yes, doctor. Sorry for the interruption. Please
Yeah,
proceed.
no problem. Yeah. So the lady feels the breast with the tip of her fingers. They feel in circular motions from the nipple through the entire breast. You do not pinch it with your fingers. You have to feel with the tip of the fingers, and various positions, lying down, sitting, raising your hands up, keeping over the hip, and you check for yourself. You do with your right hand the left breast, and with the left hand your right breast. You do all these procedures. And then if you find any lump, you report to the doctor immediately. Final, after finishing the examination, you squeeze your nipple and check for any discharge. So this is how you do a breast self-examination. I think I have a short video on that. I will just show, just a minute. Mute. Go back to my diagram.
Doctor, we are not able to hear the audio of the video.
1 second, we are just looking into that. You just I'll pause and let you know.
One must understand the importance of diagnosing it.
Are you able to hear?
Yes, doctor.
Are you able to hear the voiceover from the video?
Yes, we heard the voice.
Okay, I'm playing the video, 4 minutes of breast self-examination. All right.
Okay, doctor.
Early. You can start by learning breast self-examination. It is a simple technique that can be done at home. Women aged 40 and above, though, must make breast self-examination a monthly routine to keep track of any new developments in the breasts. Performing it without fail is as important as preparing for one's menstrual cycle or planning a visit to the parlor. Here's a step-by-step guide to breast self-examination, a useful and important screening method. To find any changes in your breast, understanding the organ is key. Breast self-examination can pick up cancer at a very early stage. The ideal time to undertake the self-examination is a few days after your monthly menstrual cycle ends. Postmenopausal women can choose any day in a month. Step 1. Look at your breasts in the mirror with your shoulders straight and your hands on the hips. Here's what you can consider to be normal. Breasts that are evenly shaped without visible distortion or swelling. If you see any of the following changes, kindly report to a doctor immediately. Dimpling, puckering or bulging of the breast. Nipple that has changed position or an inverted nipple, pushed inward instead of sticking out. Skin with redness or rash. A mild variation in sizes of both breasts would be normal. Step 2. Raise your arms and look for the same changes. Step 3. While you're in front of the mirror, gently squeeze your nipples to check for discharge. This could be a watery, milky, or yellow fluid or blood. Step 4. Examine your breasts while lying down. Use your right hand to examine your left breast and your left hand to examine your right breast. Using the flat pads of your first 3 fingers, press gently but firmly in overlapping circles. Do not pinch your breast between your thumb and index finger to feel it. Start from your collarbone till you reach the bra line. Move your fingers in concentric circles, either up and down or sideways towards your nipple. Also, carefully examine the area between your breast and armpit. Switch arms and repeat the step with your other breast. Gently feel for a lump or thickening. Be sure to check every part of your breast. Step 5. Feel your breasts while you are standing or sitting. Many women find that it is easier to feel their breasts when the skin is wet and slippery. Hence, they prefer to undertake this self-examination in the shower. Repeat the entire steps as mentioned in step 4. What to do if you find a lump? Do not panic, because most lumps are not cancers. Report your findings to your doctor immediately. Please note, breast self-examination is not a substitute for a mammogram. A mammogram reveals a breast lump even before it can be felt. Annual screening with a mammogram is recommended for women who are 40 years and above. Advantages of 3D digital mammography. Detailed 3D images for detecting cancers even less than 1 centimeter in size. Comfortable and pain-free experience. Eliminates doubt instantly. Trauma-free biopsy. Single window clearance for saving time and cost. Fix a date every year for breast cancer screening. Do remember the date and take care of yourself and your loved ones.
Very good video, doctor. Thank you for sharing.
Thank you. Thank you. Okay, so back to the presentation. So is the presentation visible?
No, sir.
No, doctor.
1 second. Just share பண்ணுங்க. Hello. Hello. Thank you. Okay. Okay. Thank you. Thank you. எங்க கொடுக்குங்க இல்ல எனக்கு அந்த okay. Yes. Are you able to see now?
Yes.
Yes.
Full screen.
Hello.
Yes, doctor, we can see you.
Screen now. Are you able to see the full screen? Yeah. Are you able to hear me?
Yes.
Doctor.
Yeah. Okay. So this is mammogram. So you do mammogram after 40 to 45 years of age, once in a year. Now this is about breast cancer. Then some common gynec malignancies, which is uterus cancer, cervix cancer, ovarian cancer. So uterus cancer, mostly 99% it occurs in postmenopausal ladies. So in any postmenopausal lady, the moment they get bleeding through their regular periods, once it stops, and again if they get bleeding, immediately they come to the doctor. So 90% of the times, uterus cancer patients present in early stage. So we don't have to worry about it. Next is cervix cancer. As you know, as I told you cervix is the mouth of uterus, there is a screening test called pap smear, which they do once in 3 years, starting from the age of 30 years. So it is a very simple test. The gynecologist will put a scope through your vagina and take some cells for test. It's an atraumatic, non-traumatic, no trauma. Just they do some test from that called as pap smear. So this is the age group from which they do pap smear. So two tests, one is breast cancer screening mammogram, the other is pap smear for cervix. I'm not going to discuss about the other cancers. This is in general. So since our talk is today about breast and cervix, I just focused on that. So what you do, if suppose we find a lump in the breast, what do we do? You report to your doctor immediately. Now you must understand, not all lumps are cancer. Any lump in more than 50 years of age group, there is more chances for that to be a cancer. Any lump found in young girls, say 20, 30, or 35 years, usually the chances of cancer is very less. It could be something called as fibroadenoma. 90% of the times, it is not cancer in young girls. It is there are many other lumps which are non-cancerous. Okay, so don't panic. But in elderly age group, you must immediately see the doctor to rule out cancer. So what we do is we do something called as biopsy, where we pass a needle into the lump and take a small chunk of tissue and send it for diagnosis. Once the biopsy proves that there is cancer, then we do something called whole body PET scan, which is a full body scan, which will tell you where all that cancer has spread. Now based on this, we arrive at a stage. Whether it is first stage, second, third, or fourth. First stage means the tumor will be less than 2 centimeters. Second stage, the lump can be up to 5 centimeters. Third stage, apart from the breast, it could have spread to the nearby lymph nodes. Fourth stage means it has spread everywhere to the body. So these are the stages of cancer. Now, based on stage and type of cancer, the type of treatment is decided, whether it is surgery, radiation, chemotherapy, depending on the type and stage of cancer. So this is a radiation mission. It is similar to the X-rays. So this mission gives radiation, and there are some myths and facts regarding cancer. So usually they say no cancer. If you're diagnosed with cancer, it's a death sentence. No, it is wrong. Cancer is curable in early stage. If you come in early stages, it is completely curable. Many believe chemo and radiation are very painful procedures. There are latest radiation techniques, latest chemotherapy techniques where the pain is less or it is totally painless at times. Many people ask, sir, biopsy panna cancer பரவிடும் சொல்றாங்களே. I don't know from where they got this notion, but many people believe in this. If you do biopsy, they think that it may spread. So which is again wrong. Biopsies done by surgeons, and it is a procedure needed, very much needed, to find out what type of cancer it is. And cancer is painful, and painless lumps are cancer. This is a myth. Cancer lump is usually painless. Cancer lump in the breast is usually painless. Please remember, if it is painful, it is not cancer. They feel it is a disease of old age. Nowadays, even we see young ladies having cancer because of changes in lifestyle, whatever be the reasons. But we do see a lot of ladies, even 35, 40, 45 years age group. It is not just a disease of old age. So all have to be careful. So once we diagnose, once we arrive at the stage, there is a multidisciplinary meeting which involves all the cancer specialists. These are very many cancer specialists, a surgeon, a medical specialist, a radiation oncologist, nuclear medicine, plastic surgeon, like that. We have multiple cancer specialists. We sit together and discuss and decide what is the treatment plan for a patient, and we execute it accordingly. So we come to the end of presentation. Any questions we will take now?
Thank you so much, Doctor. Lakshmi, you had a question for Dr. Senthil.
Yes. Can I ask now?
Yes.
Or you want? Okay.
Yes, yes.
Doctor,
Yeah,
you have
please.
said that obesity will be the reason for cancer in kidney, pancreas, and gallbladder. How that is possible? Can you tell us that how it's related?
Obesity, I did not say it is the reason. I said one of the reasons, one of the causal factors is obesity. You understand?
Yeah.
So, main is uterus cancer. Uterus cancer, we see ladies who are very obese, diabetic, hypertensive. So, there is no specific explanation why it happens, but one of the causating reasons for uterus cancer and breast cancer in special is obesity.
Thanks, doctor. I have one more question. This HPV vaccine, which you have recommended for the children, young girls, it is not available for older women like above 50?
Okay, so what you must understand, the principle behind the vaccine is the HPV virus that is the causative reason for cervix cancer. Almost 99% of cervix cancer has a HPV virus. Okay, and that virus is sexually transmissible. Okay, so the vaccine has to be given before the onset of sexual intercourse. The effectiveness of vaccine, 3 doses they give, remains effective before the onset of sexual intercourse or at the max a few intercourses, which happens in the early age group, not at 50. By 50, everything is complete. So there won't be any effect of the vaccine. So if you see, unlike India, the Western countries, they recommend it at 9 years of age because there the sexual exposure is much at a much lesser age group. Early teens itself, it is very common in their countries, but in our countries, still it has not become that common. Hence, we say 12, 13 years, but even before that, it can be taken. So, hence, it is not useful for ladies after, say, 20, 25 years or after your first few sexual intercourses, it will not be helpful.
One more last question from me, doctor. How alcohol is related to breast cancer?
So again, like in cigarette smoking, I have, if you remember the clip I have shown, there are 72 carcinogens which they have identified. So carcinogen is a substance which can cause cancer. Like that, they have initially there were a lot of debate about alcohol. A few scientists were saying it is not a reason to cause cancer directly. It is just an associative factor where when you take it with smoking, it just potentiates the effect. But there were some groups of scientists who were telling no, alcohol in itself can cause cancer because of the metabolites of the alcohol. Whatever the alcohol gets broken down in your body, those chemicals can react and cause cancer. So the debate is still going on, but the recent guidelines as per the WHO, they have said alcohol in itself can cause cancer. The reason is the metabolites of the alcohol can behave like harmful substances in the body which can cause cancer. So that's why they have given a safe permissible limits for alcohol.
One more question, doctor. Sorry. Why in women the most of the cancers is either in breast or cervix and not in the other organs?
So these are statistics. So say 100 ladies, or you take 100 ladies with 100 different 100 ladies, and you do a cross section study. We find that breast and cervix is the most common. More than 50 of them is breast and cervix.
So it's
There is
based
no
on the.
there is no specific reason. This is worldwide. Cervix cancer is very common in India, not worldwide, but worldwide. If you take the number one killer disease among women, I won't say killer disease. The number one most common cancer is breast cancer.
When somebody reaches
Doc-
the stage 4 of
Okay.
the breast cancer, and then like as you have shown in your picture that it is spread to part of lungs, back, bone, and neck and other areas, the survival is very less, doctor, even though chemo is given.
In breast cancer alone, I'm talking. Forget other cancers because in other cancers, survival is going to be less. In breast cancer, Depending on that.
Sorry to interpret, doctor. This person has had a breast cancer, removed her breast 7 years ago. It has returned now in other parts, not in breast.
Yes. So in breast cancer, which has recurred in other parts of the body like lungs, brain, liver, depending on type of breast cancer, there are 5 main types of breast cancer. Depending on that, the prognosis varies. If it is a strong hormone positive disease, they survive for 10, 15 years also. So we have patients with spread to lungs, spread to bones, living for more than 10, 15 years. But this happens only in specific breast cancers, not all.
Thanks, doctor.
Good evening, doctor. I have a question. What is the percentage of possibility of breast cancer in a patient or a person who has removed the uterus and ovaries, a complete hysterectomy?
For some other reasons, you have removed uterus and ovary. So you mean to say, will it act as a protective factor against breast?
Yeah.
I don't think so, because though we say strong hormone positive breast cancers are technically, having very good prognosis, but someone who has removed her ovaries cannot offer full protection. Even then, still they have to continue with the screening protocols.
Okay. Thank you, doctor.
In such case, doctor, up to what age they should screen their breast?
I don't get your question. Which cases?
In such case that when the ovary and uterus and cervix is removed for somebody, so till which age they have to screen or do mammogram for their breast?
See, whoever is the patient, whether your uterus, ovaries are removed or your general population, the screening continues till 70 years of age. 70 to 75, they say. It depends on the life expectancy. Say in India, the life expectancy is up to 68 overall. But now we see in our OP patients with higher socioeconomic status and good, educational status, their survival is more because of various factors. So basically, you increase the screening period also to match the expected age expectancy. So if you see in abroad, if it is say 80 years or 90 years in Japan, they increase the screening up to 80 years. You understand? So in India, I would say up to 70 years. It is, but if you are in good health at 70, I will recommend it throughout your lifetime. Because you have patients at 75, 77, 80 years also. So when someone is healthy and active, there is no point in stopping themselves from screening. Even if you're 70, you can come forward and do screening every year.
Doctor, we do a lot of awareness campaigns for breastfeeding and encourage mothers lactating to do breastfeeding. But for those mothers who are not able to breastfeed their children, is there the danger of breast cancer more?
Usually, they say if there is no breastfeeding from the mother, the breast development is not complete. Some people by choice they don't do, but many of them because of medical reasons they are not able to do. But yes, it is a risk factor if they have not done breastfeeding. So such and people who don't have children, again it doesn't complete the cycle of the breast development, so they are called as nulliparous in medical terms. So people who don't have ladies who have not given birth to child, who have not breastfed, they are slightly at a higher risk. I wouldn't say huge, slightly at a higher risk compared to normal population. And they should be all the more careful when it comes to screening.
So I think the breastfeeding awareness and breast cancer screening awareness goes hand in hand.
Yes,
Any
you
other
can very well
questions?
say. Yeah.
Yeah, good evening, doctor. Ruth here. My mom had undergone a mastectomy 3 years back. So
Okay.
I haven't. I mean, we have 4 daughters for my mom. So I haven't done any test after that. Though the doctor, whenever I take my mom for a review, asks me to do it. So I've not been doing it. So what would be the immediate test that I should undergo, doctor?
Very good question. So the first question I will ask is, at what age your mother got breast cancer?
73. 3. She's 3. She's 76 now. 3 years back. 73.
Okay. So the risk of breast cancer running in families happens if the index patient, that is the first patient, whoever in the family has breast cancer less than 50 years of age. Okay.
Okay.
If suppose someone says my mother got breast cancer at 50 years of age, then the chances of that running in families is high. So if suppose a lady gets breast cancer within 40 to 50 years breast cancer, then the chances that her children may develop is a bit higher. But if there is a history of breast cancer at 50, above 50 years of age, then the risk of it running in the families is less. So you will come under a routine screening protocol. Routine screening means any general population, whether
Mhm.
since your mother has got breast cancer at 70 years, it doesn't put you people at risk. That is
Okay.
the first thing to understand. Age of diagnosis. Second thing is how many other members are affected with breast cancer in the family. So how about the siblings of your mother,
Nobody, doctor.
your
I mean,
grandmother?
nobody. No, my grandmother passed away at 84. She was hale and healthy.
Yes. So again, you have no risk. If there are two or more members suffering
Mm.
from breast cancer or breast ovary cancer, then again the risk of family cancers come. Say example, if suppose your mother's sister also had breast cancer, then yes,
Mm.
the risk of family cancers are there. Then what we do is we do something called as genetic testings. There are genetic testing available where you do in the patient, if suppose the patient is less than 50 years, and
Mm.
then look for any genetic mutations and then run the same test in the siblings, in her daughters, in her mother, everyone, and find. So this is how we evaluate for hereditary, genetic, family-related cancers. But since your mother has got 70 years, I don't
Mm.
think there is any extra risk for other family members, and I will advise routine screening protocol. Routine screening protocol means after the age of 45, you do a mammogram every year routinely, or once in 2 years you do a mammogram.
Okay. Okay.
This advice is for everyone, not just because your mother has cancer. It
Get
will
it,
be
doctor.
routine screening protocol.
Okay.
Doctor, I have a very probably a silly question, but if you look at the way women are having the clothing pattern today, it's more of fancy and lot of bras that they use and the innerwear that they wear is not cotton based or something that is suitable to our climate. Will this also have an impact on the way the health of the breast?
Very good question. I won't tell this as a silly question because I have been asked about this question multiple times in multiple forums. Because I think this is a very basic thing which goes in everyone's mind. There is no such excessive risk with the type of innerwear they wear. I don't think so. There are any studies to support also, and I think you are free to wear whatever you want, and there is no per se any such issues which arises out of clothing.
Any other questions from anyone in the team? Okay. Thank you so much, Doctor. Very insightful meeting. And in fact, I think though we had a very focused audience today, we did a recording so that we can post it to our college students and also for our women forums. And you have been very patient to answer all our questions. And I think the Q&A part was very interactive and we enjoyed the session. Uh, in fact, I've seen some of the slides earlier during another session from MIOT, but this has been very, very fruitful, and the way you presented is quite appreciable. And thanks to everyone who participated today and for all your questions, because I think what makes each individual have an understanding of this particular disease is very unique. So it's very important that we come out and speak for ourselves, because as women we tend to hesitate when it comes to women health and wellness. But I think this is the first step that we are taking this year to promote women physical wellness as well. And thank you so much, doctor, because getting your time and getting that full 1 hour from you, I think we are privileged today. And thanks a lot to Kirtana for arranging this, and also for Ambika for coordinating on this, Lakshmi, Aparna, and others for your valuable questions, Ruth. Thank you so much, and everyone who participated here. And I'm hopeful that this session had thrown insights that we all should start taking care and listening to our body. First and foremost, self inspection is important, and we need to listen to our bodies and step in. So, thank you, Dr. Senthil, and Kirtana, over to you.
Thank you very much. I thank all the organizers. I thank especially Kirtana, and I must be very thankful because it was a very interactive session. Usually, when the participants are with full of energy asking different questions, the presenter also feel the session is complete. Without the question and answer session, you feel the session is incomplete. And regarding the presentation, I can send forward the video. I think that is the very useful video. I will ask
Please do
Kitna
share
to
it.
give it to you so that you can share wherever you want it. Okay. Thank
Sure.
you.
Thank you so much,
Thank you.
Doctor.
I will wave over to Kitna.
Thank you, ma'am. Thank you for joining in for the session, and I'll see you again for the other activities, ma'am.
Thank you. Thanks, everyone. Thank you, Ambika and everyone.
Thank you, Kirtana. Thank you. Bye.
Bye.
Thank you.